Hello, welcome ladies and gentlemen to today's tutorial. Today I want to look at the lungs. Remember that the lungs are two and they are located on either side in the thoracic cavity, sandwiching the heart, which is found in the mediastinal. Remember that yes, there are two lungs. The right lung, which is a bit bulkier and heavier than the left lung, will weigh around 600 grams on average. The left lung weighing just around 550 grams on average. Because the diaphragm, the dome of the right part of the diaphragm, tends to push superior because of the bulk of the right lobe of the liver. Then what happens is that the right lung will be a bit stout, will be shorter compared to the left lung. Again, because the left lung, yes, medial portion of it is quite accommodated by the heart. Then what happens is that the left lung tends to be a bit slender, and therefore it tends to be a bit slender compared to actually the right lung. Now remember that these lungs are going to be very important. We've already seen some of the conduction portion. If you look at the nostril, the nasal cavity, yes, if you look at the pharynx, the larynx, if you look at the trachea, if you look at the main bronchi, secondary or lobar, and of course segmental bronchi, all the way to the terminal bronchioles, they are going to help conduct. By so doing, by conducting these, this air, what happens is that they are going to humidify, they are going to condition it actually by way of humidifying it, warming it, yes, removing particulate matter. Now the respiratory portion, which will include actually the respiratory bronchioles, yes, and if you look at the alveoli, the alveolar sacs, and of course even the alveolar ducts, yes, they are going to be mainly involved in exchange of gases. Yes, remember that even when you look at the respiratory system, what happens is that we have actually the upper respiratory tract and of course the lower respiratory tract. The upper all the way from the nostril, yes, nasal cavity, yes, the pharynx, the larynx, of course, the superior portion of the larynx, which is above the vocal folds. Then from vocal folds downwards, the trachea, the bronchi, the bronchioles, up to the alveoli level. They are all going to be involved. They will form part of the lower respiratory tract. Now the lungs, some of these structures are actually within the lungs. For instance, if we talk about part of the primary bronchi, as well of course secondary, tertiary, the bronchioles, the lungs, which are actually going to be very important as far as exchange of gases are concerned, are going to be involved. So we look at the lungs, look at the alveoli as well. So without much ado, it's going to be important that yes, the lungs is going to help bring in oxygen and then take away excess carbon dioxide rich blood out of the body. So that actually it's going to help to actually oxygenate the blood by way of hematosis. So let's look at the lungs. So this is the lung. Remember that when you take the lung is somewhat conical shaped, as you can see, it's somewhat conical in shape, like these ones, conical in shape, and it's going to present with what we call an anterior border, which is a bit sharp and it's well defined, yes, and then we also have what we call the posterior border, which is ill defined, it's blunt. And then at its lower end, we will have the inferior border, which is also sharp. Now, what we find is that we are also going to have what we call an apex, superior portion being the apex, which actually goes beyond even the first rib, the apex. And then we also have the base. Remember that the base is somewhat semilunar in shape. It's quite deeper. The apex is quite convex in shape. You take a superior view, but the base is concave, having this semilunar shape. Now again, we look at these surfaces too, that the lung will present with what we call costal surface, which will be related to the ribs, and they will make impressions. So as you can see, there's an impression, or these are impressions made by the ribs. These are the costal impressions. So this area becomes the costal surface. Now those elevated, portions which you find here in between the impressions actually represent the intercostal area or the intercostal spaces. Now if you turn it this way, then you have the mediastinal surface. Mediastinal. Now we said that the heart, is somewhere between the two lungs in the mediastinum. So this area is the mediastinal surface. Even with the mediastinal surface, a bit posteriorly in the mediastinal surface, you have this area which is related to the paravertebral gutters. So you have left and right paravertebral gutters, so will be related to it. Now this area represents where we have the hilum. Okay, hilum. Remember, the hilum or the hilar area is the gateway to any structure. So this is the hilar area, this depression. And remember that this lung will be covered by what we call pleura, a serous membrane. And over here, the hilar area will have some structures which will either enter or leave the lung. By so doing, there are reflections that this pleura will give to these structures. These structures represent the roots of the lung. So we look at all those relations. Now, it projects inferiorly. The pleura, after covering the roots of the lungs, will project inferiorly and give rise to what we call pulmonary ligaments, as you can see here, pulmonary ligaments. So it's actually an inferior, reflection of the pleura, which is covering the structures at the roots. Now remember that even we have superiorly, we have what we call suprapleural membrane. Suprapleural, so above where we have the cervical, this area is more related to the neck. So the pleura over here is called cervical pleura. So covering the cervical pleura, this is the suprapleural membrane, which is otherwise known as Simpson's fascia. Simpson's fascia. So what happens is that this one is able to help, give some support to the lungs in the neck area. So this is the suprapleural membrane or Simpson's fascia. So these are what generally the lung is going to present with. Now, how do I know? Now we said that we have two lungs. So how do you tell the laterality of the lung? It's very simple. Just invariably, you can just count the number of lobes that you are having. So for instance, this one I'm having one lobe. This is a superior lobe, and then there will be a middle one. This is the middle lobe, and then there will be an inferior lobe, very large lobe. So once I'm able to count 3 lobes, then invariably it's going to be the right lung. So what happens is that the superior lobe and the middle lobes, superior and middle lobes, are separated from the inferior lobe by an oblique fissure. Superior and middle lobes are separated from the inferior lobe by an oblique fissure. And then the superior and the middle lobes are separated, by what we call a horizontal fissure. Giving you these 2 lobes to be separate. Now, sometimes even with the right lung, it may not present with 3 lobes, it may be 2 lobes. So how do you know? and it's very simple for you to get to know this. Then you hold the lung with the posterior portion in the corresponding hand. So this is the posterior border, very blunt. So once I'm able to hold it so that the anterior border faces anteriorly, very sharp, and the inferior border function here, and then we have the structures forming the roots of the lung in the hilar area facing medially. So once I hold it this way, then I know I'm looking at the right lung. Because when I hold it this way, it won't be so. Because what happens is that I'm not able to have firm grips of it. Okay, so this one moves this way, which is wrong. It's supposed to be this way so that you're able to hold, the posterior, border in your hands, so that your thumb, okay, actually faces the mediastinal area this way. So once you're able to hold it with the appropriate hand, with the thumb facing the mediastinal area, because if I hold it this way, my thumb faces the costal area, which is wrong. Alright, so this is the right lung. So the right lung is going to have 3 lobes generally. It's also going to have 2 fascias, a horizontal fascia, which will divide the superior and middle lobes, and an oblique fascia, which will divide the superior and middle from the inferior lobes. Now, for the left lung, we are able to have 2 lobes. We will have 2 lobes, and these 2 lobes are the superior lobe and the inferior lobe. Remember that the superior and inferior lobes are separated by an oblique fascia. So let me show you the clarity here. This is the oblique fascia, which is separating the superior from the inferior lobe. Now, remember that you can't always rely on these fascias, because if you can see here, it appears there's another lobe here. So there could be that kind of variation. So always stick to it that if you are allowed to hold it, then you should hold it so that the corresponding hand that you hold with it, the thumb, faces the mediastinal area. Alright, so once I'm able to hold it this way, then I know this is the left lung. Now, having seen this, then the next thing that we have to know is to learn about, what are the structures which are found in the hilum of the lung. What are the structures which are found in the hilum of the lung? How are they arranged? So if we take the right lung, again, this is my right lung, then remember that always you find the most anterior structure will be the superior pulmonary vein. The most anterior structure always will be the superior pulmonary vein. And then the most inferior structure will be the inferior pulmonary vein. So these principles should always guide you, so that in looking at the structures at the hilar area, you don't get confused. So let's look at it. Now, because this is the right lung, what happens is that, we have what we call the superior. This one that you find here is the superior lobar bronchus. Superior lobar bronchus. Now remember that in relation to this one, which we call it the pulmonary artery, bringing the oxygenated blood to the lungs, we are able to describe. Now there's another one here which will have the same consistency. They are having a core of hyaline cartilage. Okay, so this one over here, okay, the most superior structure in the hilar area of the lung, the root of the lung, will be the superior lobar bronchus. But because it's above this pulmonary artery, we also call it epiarterial bronchus. So if you hear epiarterial bronchus, we are still talking about the superior lobar bronchus. So the superior most, then you come to what we call the pulmonary artery. Then the next one, okay, as you descend, then you go to what we call the inferior lobar bronchus. Inferior lobar bronchus. Yes, or we call it, hyperarterial bronchus, because it's below this pulmonary artery. So hyperarterial bronchus. And then, we said that the most anterior structure, because there's the anterior border, the most anterior structure is the superior pulmonary vein. Superior pulmonary vein. And then the most inferior structure is the inferior pulmonary vein. But of course, we can see another vein over here, which is of course going to be, I think, another vein, which is a pulmonary vein. So there could be that variation. So there could be that several structures happening here. Yes, there's another accessory, vein in there. So from superior to inferior, then we are going to have epiarterial bronchus, pulmonary artery, hyperarterial bronchus, and then of course inferior pulmonary vein. But from anterior to posterior, then we are going to meet the superior pulmonary vein, pulmonary artery. Then of course you're also going to have these hyperarterial and epiarterial bronchi over here. So that's how the structures present here. Now, having seen these structures, then the next thing is what impressions are made in the right lung, mediastinal surface of the right lung. Remember that there will be some structures which will be related here, and therefore because they are related to it, they may make some impressions which we want to see those visible ones. So over here, around this area, we have this area having impression for the trachea a bit anteriorly, and then posteriorly for the esophagus. For the esophagus, thoracic esophagus, of course. So trachea and esophagus. But remember that trachea is a bit anterior to the esophagus, making impressions over here. And then as you descend, yes, the esophagus will continue to make that kind of impression over here. You may have that impression over here. All right, now, having seen this, then the next thing that we also see is that we also have what we call, over here, we have what we call subclavian. There will be impression by the subclavian artery. Subclavian artery. Subclavian artery. Now, over here, there will be impression actually made by what we call the azygos vein. Azygos vein will make an impression over here around this area, not very clear. And then over here we will have impression actually made by what we call the right brachiocephalic vein. Right brachiocephalic vein. Now remember that they are both draining into what we call the superior vena cava. So this area will be related to the vena cava. So this will be the caval area. So we've seen these ones. Yes, the azygos vein, right brachiocephalic vein. Yes, related to the superior vena cava. Now, of course, for inferior vena cava, it will be related somewhere here, inferior vena cava. Now, the next thing that we also see is that we also have, groove for the first rib, which is somewhere here, but not very clear. The groove for the first rib will be here, but not very clear. But over here will be the area which will be related to the thymus. The thymus, as well as the mediastinal fatty tissue. This area will be related to the thymus as well as the mediastinal fatty tissue. Then around this area, inferiorly, we will have impression for the heart, impression made by the heart. So this area will be the cardiac impression. So these are how generally the structures will relate with the lung at its mediastinal surface. So that is what we are going to find over here. Now, if we take the left lung, at its hilum, yes, again, we also have those structures forming the roots. Now this time around, because if you take it at a bit, I will show you something so that we can do that comparison. Now, this one, if you look at it, this, at the level of, these are the tracheal rings. At the level of carina, usual T5 level, which is also related to the sternal angle of Louis. What happens is that, yes, the trachea will bifurcate into what we call the right, main bronchus and the left main bronchus. Now, what we find is that these areas, will be extra, pulmonary, and the rest will be intrapulmonary. Now, remember that even the left main bronchus is quite horizontalized compared to the right one, which is a bit more vertical, even having a larger lumen, and it's been shorter compared to that of the left main bronchus. So usually upon aspiration, you realize that it will get into, of course, likely if you take an X-ray, it is going to likely be lodging in the right main bronchus than in the left main bronchus. So that's one thing. But the reason why I want to show this is that at this level, if you cut it over here, then you are going to find, the epiarterial bronchus and the hyparterial bronchus. But if you cut it around here, you are going to find only the primary bronchus of the left one. You won't find anything. It has not started to, divide to give those segments yet. So over here, we are going to have the most superior one being the pulmonary artery, the most superior one being the pulmonary artery. Again, our principle holds that the most anterior one will be the superior pulmonary vein, and the most inferior one being the inferior pulmonary vein. Then, of course, this actually represents, it was cut a bit deeper, so it has begun even divided. So this one, if it was cut a bit superiorly, then this one represents the pulmonary, represent the bronchial, the primary bronchus, the left primary bronchus. So that's what we are going to find here. Now, from superior to inferior, then we are going to have the pulmonary artery, primary main bronchus. Okay, but actually we are going to have the pulmonary vein, primary main bronchus, then inferior pulmonary vein. Then of course, from anterior to posterior, then we are going to have superior pulmonary vein. Then, of course, we're also going to have the pulmonary artery, and then of course we're going to have the pulmonary bronchial primary bronchus, just around that area for the left, lung. So these are the structures, how they are arranged, in the hilar area. So So as you can see, there's the pulmonary artery, superior pulmonary vein. This is the main bronchus, and of course inferior pulmonary vein. That's how they are arranged. Now, how about the structures which make impressions in this area? Now, let me show something that this superior lobe, okay, actually presents with a cardiac notch, and just after presenting with a cardiac notch, which you can see here, it gives off this tongue-like process, which is actually supposed to be the middle lobe. So it belongs to the superior lobe. So remember that this is known as lingula. So lingula is part of actually the superior lobe. Now, so let's look at the structures making impressions in the mediastinal area of the left lung. Now, yes, again, for the left lung, just like we saw for the right lung, we are actually going to have what we call the area which will be related to what we call this area will be related to the trachea and the thoracic esophagus. And then we also have the area which will be related to the subclavian artery. So over here will be the area related to the subclavian artery. So trachea, subclavian artery. Then of course, yes, rib 1 will be somewhere here, because of course this one will project above. Yes, rib 1. And then over here we can see this is the descending thoracic aorta, the impression made by the descending thoracic aorta, which of course will come actually as arch of aorta. So this is where the arch of aorta will be related, and then we have what we call descending thoracic aorta. So from the area where you have the esophagus and the trachea, the esophagus will actually make impression inferior as it descends around this area. So as it comes all the way this way, it makes impression over here as well. Of course, we also have the area which will be related to the thymus, as well as of course mediastinal fatty tissue will be related here. Then this area will be the impression made by the heart. So this is the cardiac impression, but this cardiac impression is quite deeper compared to that one we find for the right lung. So mainly that's what we are going to find with the left lung too. Now remember that yes, the lungs, essentially where gaseous exchange is going to take place will be actually the alveoli. So remember that yes, you have these we are going to have these main bronchi giving lobar bronchi, and these lobar bronchi or secondary bronchi will give the segmental or the tertiary bronchi, several of them. And actually, as the rings of cartilages, as you move, then they become plates. And usually at the level of bronchioles, they are replaced by what we call smooth muscles. And that is why when these smooth muscles fail to contract and relax properly, then broncho constriction can actually happen, especially in situations where you have asthma. But essentially, this pulmonary artery will branch further and give off these blood vessels, which are capillaries of the pulmonary bed. Yes, we're going to form the pulmonary bed. Now these are actually where the exchange of gas will actually take place. Now if you look at this is one alveolus. So an alveolus and alveolus, alveolus, alveolus. Now together, this whole bunch will form what we call alveolar sac. Alveolar sac. And of course, within them, we are going to have, some kind of ducts. We have alveolar duct as well. But these spaces that we find over here, which actually represent the lumen of these, it's represent actually the pores of corn. We call it the pores of corn. Pores of corn. So remember that even after everything, they will be actually drained by what we call the pulmonary vein. You see that the pulmonary vein is red in color because it's going to carry oxygenated blood, and then the pulmonary artery is actually blue in color because it's supplying it with the oxygenated blood so that it gets replenished with oxygen. Now, if we look at these things, now what happens is that the alveolus, the pulmonary duct, as well as the respiratory bronchioles, right? You have the respiratory bronchioles as well. Okay, they will actually come together to form what we call the sinus. The sinus, and that is where actually exchange of gases, is going to take place. It's going to take place. Now remember that when you look at the alveolus will have two main cell types: alveolar type 1 and alveolar type 2, or the so-called pneumocytes, type 1 and pneumocyte type 2. Pneumocyte type 1 together with the endothelium of these blood vessels forming the capillary bed, alveolar blood vessels, yes, together with their fused basement membrane, will actually form what we call the respiratory membrane or respiratory surface, which will help in exchange of gases because it's going to be moist, it's going to be thin, it's going to have large surface area. Yes, and of course, it's going to be highly vascular to aid in the exchange of gases. Alveolar type 2 is going to help in what we call production of surfactant. Remember that production of surfactant begins in utero around 26th day intrauterine life. 26th week of intrauterine life, and it will continue. Therefore, premature babies tend to suffer from their lungs may collapse, from lack of these surfactants. All right, ladies and gentlemen, I hope it was going to be helpful to you. Thank you very much for your audience.